Welcome to At the Nurses Station with Kelly and Sam, a podcast for nurses about everything except the patients. We are very excited. We have a guest with us today. But before we get to that, Sam wants to tell me about a coffee drink.
Well, it sounds lame when you introduce it like that. It would have been better if you were like, hey, Sam, how are you doing? And I would be like, I'm doing really well, Kelly. I have this crazy coffee drink that I found on the internet that I want to tell you about. But
okay, let's go with that.
That's fine.
Okay.
Everyone already knows that I'm lame, so it doesn't really matter. So I don't know what it's called. Some Italian old lady was talking about the things that her grandma used to make. You take an egg yolk, not the white, just the yolk, mix it with a bunch of sugar and like beat it in the coffee cup until it's like nice and frothy. And then you put your coffee in there and then you drink it and it's delicious.
Well, isn't that how you make like whipped cream? Or is that's the egg whites with sugar? Isn't that how you make whipped cream?
No, whipped cream is made out of milk.
Oh, milk that you whip.
Mm-hmm. Okay, cool. Well, it doesn't taste like egg. It tastes like nice and sweet. And you get a little bit of like, I don't know, is there any protein in the white? I don't really know, but it's fatty and it tastes good. And I like just like perked right up. And anyway, it was delicious. And so now I'm going to make it every morning.
What is it called?
Don't know.
Okay. Do you have a like electric frother beater thing or do you use a fork?
Well, we do have one of those and it occurred to me this morning, but in the video, she just uses a spoon. And she says you just beat it in the cup while her like coffee contraption that was like on the stove was making the coffee. I don't do that. We just have a Keurig. But yeah, you just beat it till it's like the macaroon kind of consistency.
Yeah.
And that's fun. It doesn't taste like scrambled eggs. Like it's really good.
If you leave it, will it like liquefy? Or did you drink it too fast to find out? No,
it didn't actually. I like drank half of it and we went swimming like at the gym and then came back and it was room temperature, but I still kept drinking it and it was fine. It was still like smooth and yeah, not like chunky.
I don't know if that's healthy. You left an egg for hours and then came back and drank it?
You mean the egg that like had scalding hot coffee poured over the top of it?
Okay, yeah. But
and also, who are we to judge night shift workers? I'll eat like a deviled egg out of that refrigerator like two weeks later. That's fine with me.
Worked.
I'm hungry.
Very true. Very true. Well, anyway. My kids have this new thing called midwinter break this week. So our schools went to a balanced schedule. Yeah. Mm-hmm. And so you have like Christmas break for 2 weeks and now it's mid-February and they have an entire week off school, which I kind of forgot about until like Friday. Yeah. And so now I have all my children home for an entire week and I'm trying to figure out what to do with them. And it's not nice out.
It's really not. So when someone else was talking about the balanced schedule, I used to do the track system when I was younger in California, does whatever they want, where you were all a color. Mm. And so you went to school for 3 months and then you got a whole month off. But like if you were blue, your months are all different than like yellow and green and red. But that's not what it is. That's what I thought. No. Oh, okay.
No, everybody like is in school or out of school at the same time. They just shortened summer break, which where we live, we don't have very long summers anyway. So they don't get out till like end of June and then they start at the end of August.
The end of June?
Yeah. So it's like, it's only 2 months off, but they get all these random breaks. As a parent, I don't really like it. But my kids seem to really like it and they seem to not get as burnt out with school. Like they're very excited that they just get a week off for no reason.
That education is about how the children feel about it, but that's fine. Yeah.
Well, I don't know. So today we're going to a movie and tomorrow we're going to a trampoline park and, I have to plan all these things. I know. Well, I just don't want to.
Mom of the year. Okay. Well, can I introduce our guest or do you want to talk? Do you have other things to say?
No, that's it. Yes, please do.
I'm going to make you this coffee though. Maybe next time we work together, you could try it.
Okay. Just don't bring me your fire cider.
Well, you might not have influenza A if you drink it. But anyway, so we're going to talk to our good friend, Jameson, who's a pediatric nurse, a charge nurse, an educator, and an all-around powerhouse in both clinical and academic nursing. So he's got years of experience at our local regional children's hospital, plus faculty roles at 2 universities. He brings both bedside experience and classroom wisdom to our conversation today. Currently, he's pursuing a master's in nursing education, which I'm excited for you, but I have opinions about. So he's working to shape the next generation of nurses while still leading like really our highest acuity pediatric care unit. And if that's not enough, we also know that he referees basketball, which is very cool. And so it's safe to say he's comfortable making big calls under pressure. Jameson, thank you so much for an hour of your time. We know that you are maybe busier than both of us combined. So welcome to At the Nurses Station.
Thanks for having me, ladies. Glad to be here.
That was like a really awesome introduction. I just have to say, Samantha, can you like introduce me that way every time? Like, just tell me how great I am.
Sure, because we're stuck on a steam, right? So that's where we're going to be. Okay. Well, Jameson, if you want to take a second and kind of I know that I introduced you, but if you want to tell us maybe a little bit about where your passion really is, are you still bedside nursing? Do you do education because you didn't trust the education system, or are you just looking till you can be a pro basketball ref and leave this all behind?
No, that's a great question. If I was younger, I probably would have said, yeah, I'm going for the pro referee thing. But at this point in my life, I always had a little inkling going into and coming out of college that like maybe someday I wanted to dabble into the clinical world. Okay. I really liked one of my clinical instructors when I was at Washington State, just really like connected with me. And I was like, yeah, I could do that someday, maybe after years of experience. But then what really triggered for me was COVID-19 actually. And going through that, coming on the backside of all the chaos and all the change and the mass retirements of people who are on the border of going. And we'd always heard about this vacuum, and like we knew that there's going to be this hole and this, the generational gap that we needed more nurses. And I realized, especially by that time I was moving into the charge role, that even in our own hospital, different units were severely having a shortage of trained staff, because through COVID, the students got totally hosed. Like from an experience standpoint, from an opportunity standpoint, like some of them said all their clinical experience was simulations. And I'm sorry, simulations have their role.
Terrifying.
But like, so they didn't even know how to talk to a real patient. They're used to like talking to this voice in the sky that you interact with to get your vital signs and stuff. Right. And it was just very obvious there was a huge gap. And then it just continued from there into 2022 is when I started thinking about trying to figure out how I could start that journey. And I very, divine providence intervention. I had a interaction when I was coming off shift as a charge, where a clinical instructor for a school that I currently work for was bringing students by. And I just you don't know if you don't ask. And I just asked, like, how would someone get into the world of clinical instructing? And she's like, oh, well, I'm looking for someone to take over my spot. So, like, let's meet up and have coffee and have this and an email. And here's my phone number. And a few months later, I was the clinical instructor for pediatrics at Lewis and Clark State College, and have been there since. And then that delve into a former coworker from PICU who was helping start up Eastern Washington's nursing program, who was in the sim lab, reached out to me in June of, would it be 2024? And just asked, hey, do you have any interest in helping us with a pediatric clinical role? And I was like, sure, great. Yeah. Well, I'm loving it with one school. Why not try it with the second one? And then the rest is history. Like, I just fell in love with it. I've always been passionate, even when I was a new baby nurse and everything. Like, if I had someone who was under me, I wanted to give them as much information as I could that I knew, so that people don't have to make the same mistakes twice. And I feel like overall, I'm pretty good at educating people or sharing experiences or helping meet them where they are. And it just kind of felt like, just you hit that groove, you hit that fourth or fifth gear in your manual vehicle, and you're just like, oh, we're cruising now. And then I was like, oh, well, now I have to figure out what to do next. So that involved choosing a degree path that eventually will lead towards transitioning primarily into education and hopefully like supplemental role at our local hospital to stay relevant and stay connected and everything. But I know it's very long-winded, but
we might need to put a disclaimer on that, Kelly. For any of you under the age of 30, when he's talking about gears, we used to actually have to change them in the car.
There's a third pedal.
There's a third pedal in very old cars. There was a lot of difficulty that came out of COVID, but it is like nice to hear some of the stories of like, actually it opened my eyes so I could make this really positive change for a lot of other people. So I think that that's really encouraging. I'm sorry you have to get your master's degree to teach nurses how to be nurses. I feel like you could probably do it without that, but I don't make the rules. So.
I agree, Sam. Yes, I definitely feel like it will just be a title.
Yeah.
And a check of a box that then I'm allowed to take a position with benefits and salary and all that stuff.
Kelly has her stop hating on education face. So,
no, I actually agree. I have started my master's program twice and quit twice. The reason was I don't like paying for an education that I see no benefit in. Yeah. So like I was going through this master's program and I'm like, this is so stupid. Like I am writing papers that I don't care about that will not enhance like my ability to teach people in any way possible. Yeah. And I was just like, no, that's stupid. I do have a question though, because we have a lot of friends that are going into nurse practitioner school right now. Did you ever consider like NP versus education?
Briefly, when I was before COVID, I had kind of looked into it a little bit. But then that just, in my opinion, looking through it, especially now, hindsight is, obviously a blessing. It changes how you teach because your role has now changed to where you are a licensed provider prescribing, And so I felt like that wasn't ever something I went to school to be. Like when I pursued nursing as a degree and a career, I felt truly called to it. Like I still feel called to it. Like it was something I prayed very much about and thought long and hard and like took lots of every advice and information I could get. And I truly wanted to be the frontlines person at the bedside. And all of my knowledge and experience and skill is in that area. And I didn't want to pursue something for 3 to 5 years, depending on working and everything, and then completely change where I work. And it would also change likely it's very hard to find pediatric roles in our area as a nurse practitioner. So then it means moving, which it's just like this whole domino effect of trying to decide what's the best, not only for me, but in the best use of my talents, but also the best use of my space and time with my family. So I did definitely consider it, but it was very brief. And then I just kind of got really stagnant.
Yeah.
So similar to you, where I was like, well, what program do I want to do? And what's the benefit? And what will I learn? And then I've run into that in the last couple of years as I've worked through this master's, that there's definitely classes and topics where I'm like, how does that make me improve our future generation?
Right.
And the answer is it doesn't. It's just another box. And it truly, and some of those classes were the hardest, where I would just procrastinate hardcore about getting I shouldn't say stupid, the tasks done to learn the test learning objective and the student learning objective. But trying to apply that to real life was what's the purpose?
The thing that I would really like to see come back is the clinical nurse specialist. Maybe 10 years ago, there was a push for clinical nurse specialist roles and that degree, which was a master's degree. And if that was something that was still available, I think it is. I think there's a handful of programs throughout the country, like a pediatric clinical nurse specialist. I feel like that would be so much more beneficial to the next generation, because then you could be in an educator role, but you've actually done more education towards the why and all that.
Which I think I agree with you, Kelly. I think that's the biggest area where teaching and learning happens anyway. Like we get all this fire hydrant knowledge as I'm trying to think back now, 12, 13 years ago as a student, and you're trying to understand and you think it's all important. Every teacher in every class says this, you got to know this and you got to know this. And you're like, okay, I'm trying to soak it all in. And then you get the clinical and it's like, that's where you made those light bulb connections. That's where the nurse that you're precepted with, that you hit it off with because you busted your butt doing all the little medial tasks to try and earn respect. And then later on, you get to have that 30-minute conversation about your patient's diagnosis. You're like, oh, and you're okay asking the dumb question to get to the connection point, or your clinical instructor spends time with you. Because like really in a didactic theory course in person, like the class sizes I teach are anywhere from 28 to 40. It's hard to have one-on-one time to really connect people.
Oh yeah.
Right. Whereas at clinicals where you really get, depending on what you bring with you, which is why I always say to my students, you got to be present, engaged, and bring your best mind and focus, is that you could really make some leaps and bounds on your knowledge and understanding, because you're seeing a real person with the real diagnosis and what it looks like. And you're also gleaning the wisdom and experience of the person you're assigned with to really mesh that knowledge and understanding and wisdom. So I agree, Kelly. That would be I didn't look into that too far, but that would be a much more valuable degree and resource.
Would that be like the APRN, Kelly? I feel like a lot of my clinical instructors way back when were APRNs.
I think so. I think that's kind of the same thing. Like when I was looking into it, there was like adult, pediatric, and neonatal clinical nurse specialists. And then a lot of like high teaching hospitals would hire those as like your lead educator, preceptor. They would run the sims, stuff like that.
I don't want to be a clinical nurse educator. I don't want to do what you do, Jameson. Like, but it sounds fun, but I don't like people enough, like statistically, to have to like deal with that many new humans. But Kelly, if you and I ran a sim lab, could you imagine how much fun it would be?
It would be amazing.
I feel like every scenario we could start out something different. Like, so there was a mass murder in your town and you don't know, and you have walked in to the house where, anyway, I don't know, we could like the tornado has hit and we're triaging, or you're the only nurse on the entire third floor, something. I don't know. I feel like we could have a lot of fun, or we could decorate it like an island and be like, so.
Or like a meth lab.
Yeah.
And just have like rats crawling over like the, the
now
dummy.
Do your job. Now.
Figure it out. Yeah. Sink or swim.
Okay. Well, anybody, if you're looking for 2 sim lab nurses that are going to make the best sim lab ever, you know where to find us. I do want to jump in a little bit to the differences with the generations that you're seeing now, Jameson, and maybe what it was like when you went to school, or, you've been at the bedside long enough to see a number of kind of groups of nurses come through. So do you feel like the education that they're getting now is just as rigorous as what you remember it being, or how has it changed the actual what they're being taught?
So from a personal perspective, I feel like some things have definitely been dialed back. Okay. I remember there's still expectations and all that and time constraints, but like when I was going through WSU, like, I had something every day of every week of every class, either a quiz or a prep module, or like, it was just this, like, you were a full-time nursing student. And like, for me, I tried to work a few part-time jobs to like not have to take as many loans and things like that. But like, it was a full-time job. And I feel like more and more, especially since being an educator now, I see a lot of people who are trying to work full-time on top of doing nursing school. And it's like, I get there are different constraints. I'm trying to meet my students where they're at, but I'm like, this 2 years is going to prep your entire career and your foundation and your basis for what you're trying to build as a person, as a human, and as a professional provider, caregiver of people's health. And you're trying to wear so many hats. Like, I know pot kettle as I wear so many hats right now, but like, I truly cut back I gave up jobs and things to make sure that when I was going through school, I learned it. And I feel like there's a lot more scatteredness of priorities for the students, where they're trying to still have this hole filled and this hole filled and this need met and this want and this want. And it's like, if you just focused here, 2 years. That's all we're asking you to do to really invest. So that's one aspect I definitely have seen from my experience as a student to now. I think that there's been this push in academia, especially as I've been going through this master's program, Kelly, like, some of these classes and stuff, that there's a big push towards simulation-based learning, which again has its place. But when you replace actual clinical hours with just simulation, it's not the same. I can do a skill on a mannequin. It's not the same when the little kid's kicking you or the adult's cursing you out and flinging things and you have to get 5 people to hold them down or whatever, or you're trying to communicate with an actual doctor who is a jerk and not listening to you. And how do you do it instead of the nice person on the end of the microphone saying, "Oh, that sounds like a good plan." I'm like, how often do you ever get that from a doctor where, "Yep, I agree 1,000% with your baby nurse plan. Yep, that's going to do it,"
Yeah, they should be like, "And who are you? Let me talk to your charge nurse because I don't even know what you're talking about."
Yeah.
I do wonder about this. So I just took a tour of one of our other nursing program places, Jameson, where you don't work, actually. And they were very, and it was fine. I was like the only medical professional in the room, but they were talking about all their sims, and they're like, "This one is this tens of thousands of dollars, and this one, and we have like 8 of them, and this one breathes, and this one talks, and this one can have a baby." And everybody was really excited about it. And someone came to me and said, "Sam, your face, you look unimpressed." Then they also said, "You always look unimpressed." So I'm not sure that has anything to do with it, but I told him, I was like, "This is really cool, but like it's not what I know." I remember having to which maybe will lead me into another question, being responsible for having so much memorized, just straight facts, memorized for your test, memorized when you went into clinical. And some of the newer nurses that I've experienced, and even doctors too, they outsource so much of that because we have the internet. And I don't know how I feel about that. I mean, maybe it is good because other things can be in their head, but maybe, I don't know. What do you see in that regard?
Yeah. Oh, absolutely, Sam. So, especially working for 2 different schools has been a great learning, and then compare and contrast and like discreetly offer advice to the one that is not as established compared to the one that's new. And like, well, I'm just saying this plan works if we execute correctly. Anyway, there's a big push at one of them that we teach concept-based. We are the experts, but like the students are expected to learn a bunch of this on their own in pre-work, which I agree there should be some little, pre-something, but like a majority of the pre-learning, the foundation learning occurs before they even enter the classroom. And then we're trying to help them enhance that concept-based thing. And I personally can't stand it. Because I am a 10-year expert as a nurse. I'm a almost 8-year expert in a pediatric ICU setting that like you hired me and I'm paying me to teach this pediatric class and this group of students what I know at the bedside to be true. I feel like there's this big push recently where they teach to whatever operating system they have that develops these nurses and trains them for like the NCLEX. And that's where they try to live in. And I'm like, guys, we can't live in make-believe fairyland where everything's perfect and you only do one task at a time and your prioritization is absolutely perfect and you can't have someone that comes and helps you and multitask 5 things like we do when we're running a trauma down. Right? Like it's like I've been in a trauma with you, Sam, and like but like I always feel awkward coming down there, but I also know, hey, they're going to want this, and this. So as long as when there's hey, Sam, what can I help with this, or I know what needs to happen. Yeah. I'm just trying to stay out of the way. Whereas like my students would see a situation and I'd be like, I don't know what to do. We've never talked about this. We never, like
it's not reality. Like you're not teaching reality.
Yes.
Yeah, you're just teaching to pass a test and to get your license instead of teaching to be a nurse. And that's what I see a lot of these new nurses coming out as like, and it comes down to accountability. If you're asking them to learn on their own before even coming into the classroom, well, everybody's going to do that a little different. There's going to be the Sams in there that, read every single line. There's going to be me who looked at the pictures and kind of figured it out as I went. And then you're going to have very differing outcomes based on that type of learning, I would imagine, versus just like putting them in a real life situation and talking through it.
Yeah. So like this semester, I'm in charge of a lab with one of the schools as well. So it's super great. Okay. And so I teach in the morning about the pediatric context, I cover respiratory, cardiac, whatever. When I go to the lab, like it's supposed to be a skills lab, but like there's not many skills that like truly are pediatric only. We just use smaller apparatus, smaller devices, different technique or use of child life specialists. So I can talk about that, but until you like see it in person and realize how difficult it is to put a 4-French catheter into a little baby's urethra tract, and if it bends a little bit this way or does a weird up then down, or like I can't teach you that with a mannequin. But what I can teach you, I ran them through a cardiac baby coming into the ED
perfect
thing. I said, here's what they look like. Go. You have your 5 teammates, like no pressure. You can screw up and do whatever you want, but go. And like, there's so many mistakes, and it was good because it's like, they're like, we never even had a sim like serious, or I'm like, well, this is what when you come to clinical on Monday with me, and you're going to be saying hi to Sam in the evening, and then maybe seeing Kelly later, or seeing something like you're going to be personal. Like they're going to expect you to at least know something and not just stand there like you don't know anything, right? Like, especially if I put you in the ED, like I have expectations too, because I know what your guys' expectations are. So like we work through this thing, and it's just so enlightening for me to see the knowledge gaps between teaching this bubble and real life, and trying to find somewhere in here where we use the technology, we use the sim mannequin that can do some breath sounds and stuff, but like we're leaning so far on technology and these testing worlds where they have all these test banks and they're all NCLEX style questions. I'm like, great. But then I get to a real life situation, and you can't go 1 + 2 + 3 = 6, right? You go 1, 2, like we gotta go. We have to be able to apply that knowledge and be able to make a decision, decipher what our eyes and ears are telling us from assessment. We have to be able to see it, read the situation in a room and say, hey, I don't need to go help with the 4 people who are dealing with this one problem. How about I go fix these other things over here, even if they're minor, because it's going to alleviate strain on the room.
If any nursing student could just walk out of nursing school and learn that, like sometimes it's more helpful if you stay out of the trauma and do all of the things that I cannot do because I'm in the trauma. Like that, like, that's more helpful to me than having another person standing at the bedside.
Yeah.
And then you can talk about it afterwards. You can say, okay, let's go back through this and let me explain how I made these decisions, why I made them, what order I went in, go from there.
And then I'll like you more, and I'll pull you in with me next
time. And Jameson's gonna be like, yeah. Definitely there's a gap there. And that's where I'm trying to fill, is a little reality in the world of academia.
I'm going to jump in real quick, Sam. Yeah. I know that you have a next question, but this is kind of off topic, but we have a military base close by. And one of the best simulations I've ever been through is we went through a citywide sim. I don't know if either of you were part of this.
Heard about it, but no. Yeah.
Yeah. So we're part of we're like one of the top 10 cities that could be like attacked in a military type way. Anyways, so they did a mass casualty simulation through the whole city where they brought real helicopters from the base to different hospitals. We had to patch in different places. We had to decide what patient was going to wear. And then they brought in like real people that they had ripped up their clothes. They had made them look like they had been burned, bloodied. They're yelling. They're like acting like real patients. And that was actually a very good sim because there was no one saying, okay, now their heart rate is this. It was like we were actually like putting them on the monitor. We're asking them about their pain. We're looking and seeing that there's bone exposed, quote unquote.
Right.
Do you guys ever do sims like that? I know when I was in nursing school, they would ask if anybody had small children, and they would like ask them to bring in and do like real head to toe assessments. Okay. I feel like that's like so much more powerful than like you pushing, rails on a keypad and making a dull sound like whatever the hell rails are.
Yeah,
I've never heard
of
that in my life. Yeah.
But we do it at LC. We do it when we can get, because there's like the drama classes and people who do stuff for the performances they do down there, like we'll try and hire some of them to come in and be like the mom or the dad or something like that. Or like for mental health sims down there, they'll get people who are really good actually, and they'll act the whole part. So it's very realistic, but there's definitely a hard time getting actual kiddos in. Like something I'm looking into if I'm kept on with the local school that I work for, to see if I can ask my brother and sister-in-law if I can borrow 1 or 2 of their 5 kids when I have my first couple assessment labs, to like, hey, here's a kid, interact with them, talk to them.
I have 3 children. You just tell me.
You can have mine. Right? Mine even has this trach scar and a G-tooth scar.
Yeah. So like, I agree. Like, it's a matter of like building the resource bank and then asking and also making sure with it, I got to make sure like rules of, who's on campus or all that stuff. But like, I think that's I agree with you. It's 1,000% more powerful to see an actual live person than I'm checking a pulse and you can't really feel a pulse because it's plastic and it doesn't move or anything, or
it's exactly the spot it's supposed to be, which like
right. It's my number one thing in both classes I've taught now last fall and now this spring. I said, if any of you come to clinical and you say you find a infant's pedal pulse or dorsalis pedis, if you found one of the post-tib pulses, if you find those in like 5 seconds or less and you tell me you got no problem, I'm going to call BS, because I am a 7.5-year PICU nurse, and there's times where I search for like 30 seconds to a minute just to find one of them.
Do you have to do both? I have to do both at the same time. I can't.
Because if I do one, I think, so if I do one, I think I'm just finding my own pulse. Yeah. But if I can find if I have similar impulse spots and I'm like, nope, that's faster than me. Yep. Okay, cool. That's it. It's right. Yep. It's a 1+, 2+. Okay, cool. And then I'll go look for the other one. Yeah. But like, I just joke with them because they're so used to just, you touch, you get the feedback. I'm like, It ain't like that. And also like adults, like you touch it, it's a bigger vessel. So you're going to feel it faster. Even if it's swollen and dim at tissue, you're like, oh, that's a pretty good impulse. But like babies, they're always like, oh, it'll be easy. I'm like, okay, challenge accepted.
And I also love asking them, okay, is that a 1+, 2+, or 3+ pulse? Because that is the dumbest thing ever. Who cares? I know. It's a pulse or it's not a pulse.
Yeah. It's weak, it's good, or it's bounding. There's there's your 3. Yeah. Like,
seems normal or not. That's
yeah. But then you rope in like all of our cardiac kids that we see, and you're like, well, their 1+ could be they're strong. So like that's very again so objectively subjective that. So but it's great to ask those questions because I'll ask them to the students too. I'm like, so what do you think that is? I'm like, I'm not sure. I'm like, good answer.
Me neither.
What was the last filed? That's what I need to know.
And then compare. Okay, they said 2. Okay.
They said 2.
What's the skin color? What's the temperature? Okay, they will model. Maybe this is a little weaker. Okay, we'll take some context clues. Help us out.
So these kiddos, I guess, the students that you're having, maybe not getting the same kind of at school education. So I want to ask you about resiliency, and in 2 contexts. In the context of, are they making it through school? Because I mean, I had part-time jobs when I went through nursing school, but it was like, I mean, I slept like 2 hours a day, and that was all the time there was.
Yeah.
Just
right.
Fine.
Yeah. It was fine. Yeah.
So there's the resiliency. Can you make it through like hard nursing school? But how do you see them being like emotionally, psychologically resilient to the reality of what happened in the hospital? I know there've been a lot of books in the last probably 7 to 8 years about the coming generations and what screen time has done and what COVID has done to like their mental health at large. How do you see them managing those two things?
I can tell you, Sam, personally, like both as a professional nurse and then also as an educator, that I've had to be more of a set of ears for people about things that I didn't think I'd have to help people through at work, much less as students. Like I definitely feel like I'm part counselor, part mental health, like check-in person for these students. I think there's definitely been, as you said, I'd say in the last 7 to 10 years, like there's been this movement, about like taking a personal mental health day and all that. Like it's very much to just excuse that you're going through something hard, and not even to deal with it, but just I need a break. I just need to step back. I just need to, and there's absolutely a time for that. Like we all recognize, all three of us have seen some stuff, right?
Yeah.
We've seen some stuff that has rocked us. I've personally had it where I've had to take an extended leave from work for things to work through it so that I can get back into the zone and work through how I deal with stuff. And I don't think we all have different levels of what affects us, obviously, but I don't think any of them have really had that rocking experience that maybe some of us had growing up or going through school or stuff where like they've been guided through everything, right? They've been kind of handed here's your steps for success. Here's your 1, 2, 3, 4, 5 steps for success. And I feel like a lot of us in our generation of nurses, as humans, as adults, we had to seek that guidance out. It wasn't just hand delivered to us, right? If we went through a hard thing, like we either old school figured it out ourselves with some trial and error, obviously, hence the lack of hair and everything, or we finally realized that we were in over our head and reached out for help because we were self-resilient enough to be like, I can't handle this one, so I've got to reach out to my friends or my parents or my mentors or my whatever, my teachers. They're very much earlier on, like, this is not right. I need help with this. Like, okay. Why? Like, not as a judgment, but just like, why do you need my help with this? Let's walk me through where you're at. And half the time it's like they're not seeing the problem from like just taking one step back and the solutions within whatever they just told me and this is going on, this and this and this and this. And half the time I'm like, hey, okay, that's tomorrow's problem. That was last week's problem. This is the problem that you can address right now today. Right? Like,
see, I'm glad that you're able to do that. I feel like I lose my patience with my own children having to deal with this. I feel like if I was an instructor and I was, being brought all these issues, part of me would just be like, you got to buck it up and figure it out. Like, I feel like what the newer generation has lost is that grit, that self-awareness of, oh, I'm an adult. I'm expected to be a professional. I should probably figure this out on my own.
So I 1,000% agree, Kelly. It's nice and refreshing when I have someone who's coming back as like middle age or like our age adult who's changed their career path because they bring that perspective with them. So like last semester, something got screwed up, like schedule wise, because we lost a contract with a clinical placement site for community health stuff, right? And every student lost their ever loving mind. Because by day one of orientation, we said, hey, this just happened 3 days ago over the weekend. We don't have a solution right now, but everyone's schedule, as we said before, is subject to change because we have to fit certain hours in for you to be able to graduate with a license. Okay, so any of these days that we have prior said are going to be clinical days, like you literally should not schedule anything because on a whim, we're going to be filling spots with wherever we get it. And you would have thought we told them like they can't ever do their favorite thing again, that they're going to be in prison. And so I just stood up there. It was orientation day. I'm watching this, and my co-instructor for Peds and OB right now, she just gave me the look, and I was like, I got you. Like, I got you. So I just went up there, found my like internal dad voice since I don't have kids yet. And I was like, all right, 1, 2, 3, eyes on me. You've had your moment of vent, right? Like you've had your moment of vent, and God gave me big ears, so you can always vent to me. But we have got to move on as adults. As did it in this one adult, like she was 39. There's kids, the whole nine thing. She was like, preach, and I was like, right, like we have to move on, right? Like we cannot just linger on how unfair this situation, and that's what they wanted. They want to be validated of how unfair this thing is, and I'm like. It is. Guess what? We have nothing to do with it. If they terminate our contract, they terminated our contract.
Yeah.
Right.
And that's life. That's life.
Yeah. Like you show up to work and you don't get the same assignment. I could bitch and moan about it, or I could buck up and say, well, these 2 kids need me tonight to be the best nurse they need. And what's going on with them? Maybe I'm a better fit for what they need than having my cushy assignment that I already knew the kid for a day or 2 or whatever. Right.
And guess what? You're getting paid, right? You're at
right. I was like, so that's why I said, like, you're in this school. You came to school knowing that you were going to learn and things are going to change. Like, nothing's perfect. And I also shared them, like, you came to a newer program. We're still working out kinks. Did you think it was going to be all roses and unicorns and rainbows? No. So I just kind of like called him out a little bit gently with a little humor. Like humor always kind of helps soften the blow. But I was just like, we need to grow up. We need to move on.
I love it. You're going to be a great dad.
You're going to be a great dad. Absolutely. Kelly, did you get all of your like whole schedule when you started? There's no way I got my entire clinical schedule like the
Absolutely
first day
not.
of the semester.
I mean, to be honest, I graduated in 2004. So like nursing school is a little bit of a blur for me, but no, it was absolutely like Monday through Friday that I was in school like that. And whatever happened on those days happened. And I worked evenings and I worked weekends.
Yep.
Yeah.
You know, that's
right. Yeah. Yeah. Priority was wherever they told me I needed to be or whenever something got changed.
When I had to be there, they didn't care. Yeah.
Yep.
I mean, there was really, I feel like a time where it was like, you were thankful for being, I mean, you had to work to be in the program. And so they owned you a little bit. Like,
oh yeah. I had to actually, I've never told you this, Sam. I actually had to fight to get accepted into nursing school.
Like a person?
No, no. Like I went in front of a board. So
cool.
I did all my prereqs at WSU. I was started as a pharmacy major, and then I realized what they did, and I was like, no, I'm not doing that. So I applied for nursing school. Well, I had taken AP classes in high school. Mm-hmm. So when I applied to nursing school, I had all these AP credits. Well, they transferred one of my AP credits as like a C instead of an A. Mm-hmm. So they accepted students based on GPA. And so because of that C, I was like 0.05 below the cutoff to make nursing school. And I like got that letter and I was like, oh, hell no.
Yeah, I can see that.
I've always been who I am. And so I like called the school. I asked for a meeting like with the board and all of this. And they were like, no, that makes sense. Yes, please join us in nursing school. So.
Okay. So you didn't. So, okay. You owned them then. Pardon me.
Well, no, I am just saying like I had that grit of like, I'm not accepting this.
Yeah.
I'm going to figure out a way to get into that nursing school because I am not retaking an English class and waiting a year. I'm just not going to do it.
100%. I didn't pass a single AP class that I took, just so that you know.
Well, there you go.
Not a single test. I don't want to take up too much of your time, but Kelly and I are very aware of the struggles that we have with the next generation. And it sounds like there are some things to work out in how their education is changing to keep up with technology and, you know, what's expected of them when they hit the floor and time constraints. What are some things that you see as a positive that they're bringing to the workforce that maybe doesn't exist there? What could even Kelly and I learn from maybe the way that they look at life? And what can the existing nurses do to help them more in ways that won't give me an aneurysm?
No pressure. There's just like a whole, like, how do you fix them?
If you tell me that I have to listen to them, that won't do. Give me a different task.
Well, that's good. The guy gave me big ears because I'll try to listen to him more. So one aspect that I try to bring to my like post-clinicals, and we run for about 45 minutes. I know like no one wants to hear Jameson yak and yak and yak. And so I run through a model where they don't have one thing that they don't have that I'm trying to instill is the ability to self-reflect, right? They don't have very good self-reflection skills and how to be critical on themselves, right? So like I do this thing and call it game.
I'll teach them that, Jameson. Yeah. I can teach them how to be critical.
Let me tell you what you did wrong.
Yeah, right.
Sorry, go ahead.
No. Yeah. And so I have them give me something good from the day that you did good, was a part of that you felt was good. Something bad, whether you did it, saw it, nurse did it, doctor interaction, a patient, whatever, something bad, and then something you want to work on and be better at. And that third one's always the one that they struggle with. They'll give me, I want to be better at charting. I'm like, nope, doesn't count. You're going to learn how to chart when you're an actual nurse. I don't give a rat's behind how well you chart right now as an S1 with only one more semester to go. Like you could work in Epic, you could work in Meditech, you could work back east where they got something like that. That doesn't mean squat to me. Yes, watch how your nurse does it and how that's our life now that we have to chart stuff. But like, I want something for you. What do you want to get better at? And slowly but surely, especially this cohort I have right now for Eastern, they're able to, by the second or third time, they get beyond just, I want to be right at this task. They're like, I want to start the day being a self-advocate. I want to go up to my nurse and say, hey, my name is this. I can do all this list of skills. I'd love to be involved as much as you will let me. I want to be as helpful as much as I can. I just want to learn as much as I can. I'm like, if you came with that attitude on week one, introducing yourself is a huge thing, right? But two, like,
absolutely. Number one thing you can teach nurses is to walk up to me and say, hi, I am this person. I'm here for this many hours. I am this far along in school, because otherwise, if you just show up and sit next to me, I'm sorry, I don't have time.
Don't you dare sit next to me. If you take a chair, you can stand next to me until I give you a chair.
And part of it is I try to role model. Like when I bring them down, I try to drop them for every unit. And if I can, and sometimes it's a little hard, but I'm like,
you do a really good job.
This, especially on the ED and stuff, like, I'm like, I know, like, it could be weird. Like, hey, this is Melanie, right? She's going to be with you guys today. Thank you so much for having her. I'm around. I always try to, I'm around if you need me or anything, but I also know it's not my realm. So like, I'm not going to sit down there and pretend like I know what to do or not to do or how to be the most helpful. But I try to model that to them, that they all know. And something they all say is like, wow, you really know a lot of people. I said, I truly believe that in this professional job we have, that relationships matter more than my title, my experience, or anything. Because when I need help from Sam, or Sam needs help from me, or Kelly needed me at 11 because you guys are dying and I've got a slow pick you that I can send my helper, like, I'm going to do it because I know Kelly and Kelly knows me and that we're going to help each other. So I've been trying to teach them stuff like that. I think something that current nurses can do, one aspect that I can't fix right now because I don't have the power, is that how they schedule all the different nursing schools just pummels you guys on day shift. Like, absolutely, it's asinine how stupid they are about that. And some of the rules I've learned about in this last year about who gets what days and stuff, I'm like, really? They don't even come on that day, but they still have a reservation for that day. So we can't do an 8-hour shift and an 8-hour shift, or nope, because they're on the books. I'm like, but they haven't been there for years. It's just, so there's an aspect where I want the nurses to recognize, maybe not every instructor realizes it, and maybe not the students don't realize it. I try to bring that perspective. I know what you guys are going through, having to teach every day and not getting any compensation, not getting any recognition for it. Like, that's why I check in as much as I can, and I say thank you all the time, because I know how much work it is. Even if you aren't getting along with your student, even if they're not as engaged or whatever, like, you're still there trying to help and know that the next generation is relying on you for a little insight. So I'm always appreciative. I think I try to teach the students to be appreciative. I think for like modern nurses, so like, try to model the behavior to them that, like, I'm not bringing my own crap to work with me, and I'm not going to allow this student or this thing to, like, really, because we have a huge impact on these students of whether they'll ever consider working in your area or not. Regardless of whether they're a good student, good nurse, good person, good whatever, but like, I tell them this, and I think I try and share it with my coworkers. It only takes one bad perception to, like, ruin your relationship with someone, right? Like, I've spent years trying to rebuild the relationships that I saw how prior people interacted when they were in roles of authority within our organization, and how they treated people on different units, and what that caused from a patient perspective, what that caused from a coworker perspective. So I'm very, 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 very passionate about rebuilding relationships, and that when you need me and you call me, I will be there. And if I can't be there, I'm going to be there as soon as I can. And I think these students need that model, because having screen time all the time, they don't have the personal skills that you and I, Sam, have when we talk about stuff or can work through a problem, right? Like when we had that night where the doctor was putting orders in on the patient and kept screwing up the admit transfer process, and we had to do like 6 or 7 admit requests, and I was losing my mind, and then you were losing your mind, and you called me venting, and I knew it wasn't personal. It was like, I'm trying to move a kid up to you. What is going on? Let me figure it out, and I'll deal with it. Right?
What do you need from me, under whose name? Just tell me those things and I will do it.
Right. And so I think just having that perspective that they don't have those interpersonal skills. They just don't. They've been screen babies. They've been technology babies. They've been Snapchat babies. They've been Zoom for school babies for 2 years, right? Where like
Yeah.
They did not get and I can't help what they did in their growing up in their own family home, right? What their conversations were like, or their dinner times, or any of that stuff. But I notice there's a huge lack in that. And so I just try and model good interpersonal skills. I try to model and be mindful of that like when they say something that seems really off-putting, I don't always go to the negative that they're coming off as a jerk or as a arrogant, whatever. Like they probably don't know how bad that came off. And so I'll check in with them like, do you realize how that was perceived by a couple of people? And they're like, what do you mean? And they have no clue that how they, right? Like, so I think that's a big thing that like, we may have to do a little more, not listening, Sam, but maybe a little bit more engagement to try and get them out of that shell to like start that process a little bit better. Because there's nothing scarier than a nurse that doesn't ask questions or doesn't communicate with you, right? Like all three of you have been charge nurses. That like when you have someone that you've trained or training or working with or whatever that's newer or less experienced, and when they stop asking you questions or aren't interacting, it's like red flags, right?
That's true.
So I have a question for you, because a lot of our students will only be in the PDD for 6 hours, one day.
Yeah.
And unfortunately, like you said, we have so many students that sometimes you'll have two students with one nurse. And I want to know if this is right or wrong. So number one, like I said, I want you to tell me who you are and how long I have you for. Number two, don't ever pull out your phone while you're in front of me. You're like, if I see you on your phone, I'm done. And you can try and follow me around, but I'm done. That irks me more than anything because aren't you here to learn? But the other thing is that I tend to just say, hey, we are super busy. I'm not going to be able to like tell you everything I'm doing, but just stay on my heels and follow me. And I feel like that's a valuable like experience. And then like, as we come out of the room, you can ask me questions. We can talk about it. As I'm pulling meds, I'll be like, okay, we're pulling IV Decadron, which we give oral, which seems weird, but we do this. And like, I'll just talk through it. Yeah. Is that something that you want, or do you want more of, because then we also have nurses that are like, I'm going to let you do this. I'm going to let you do this. And sometimes that throws our whole unit into like chaos because then we're behind. We're like giving the students like a little bit too much time that it's affecting patients.
I think that's a balance. And like I go into it, like I tell them, hey, you're going to the PICU today. Like you're going to be watching for the first 4 hours to earn trust to get to do something in the afternoon. I just straight up tell them, I say in the ED, hey, they might start off slow. So you get a chance to see where stuff's at so you can hopefully help with little things. But like, don't expect a crud ton of skills, right? It's not the adult ED where, yeah, sure, try it, whatever. Like these are kids. We don't try stuff just to try it. And I recognize that like when I talk to Amy on Mondays when I'm bringing a student over from a pre-op later in the afternoon, I'm always like, hey, who do you want this student with to just be a shadow? Like I preface it that way. So like as much as I want them to see and do stuff, like seeing it on a real person is more than they've gotten to do for this entire semester because I don't have real kids in the lab that I can trial and error stuff on. I don't have like, so just seeing how we interact is valuable to me as an instructor, as a person. Like I firmly believe in the see one, do one, teach one. So if I see you do it, I'm going to build confidence with you, how you want things done when we have this kid or type of thing again. Then maybe I'll get to do one because I've seen it. I know where it's at. I'll have it all prepped. So hopefully we can cut down on the time and then I can walk it through with you, or I can tell my instructor later, or I can, you know, if you don't let me do the second one, fine, but I can tell you this is what we would do, right? Cool. Okay. I solidified that learning. I think there's an aspect with this newer generation. They think that the only way they learn is if they get to do something. If they don't, then it was a wasted day. And I'm trying to break that. Like there's value to everything we do, see, hear, experience when you're at clinical. It's not just the skills. It's not just the glory, right, of getting to do something, have another check mark. I got to do an IV. And then I'm like, chances of you getting to do an IV in the PTD are like slim to none. If you do, you won the freaking Super Bowl and like roll with it.
Right.
So I'm with you, Kelly, that like, especially when you guys get hot, like I've seen some days, like by 11 o'clock, you guys are flipping hopping. Like you've got 30 kids, you got the hallway beds out and like, that's not a time to as much as I love the people who do that, like that's not time for them personally. Like, no, we need to expedite this process. I will explain stuff later. And I love that people want students to have an opportunity, but like there's a time and place for that.
But I do see your point of the interpersonal part of that. And because Kelly, I agree with you, obviously, like don't take your phone out, just follow me. I will think out loud for you. But you have, I think that interpersonal part of it of like, don't take this as I don't want a student, because that's not, because if I don't want a student, I won't have you. Just know that, like, there's no one can make me do this. But like, just watch how I interact as a nurse with the other nurses, with the patient, even with you, and absorb a lot of that. I think that makes a lot of sense. Just those interpersonal skills.
And I think one thing I've heard often all over the semester is like when students have negative experiences with just in your department, right? Is that it's times where they're busy, right? You guys are busy. And then
what? In your department.
I'm just using as an example.
I don't even have students, so it can't be me.
I got my own issues in my department that I can't fix right now. So
it's fine.
Yeah, we've had conversations about that. But like specifically, since you guys both work in the ED, right? Like one thing that the students say is like, I don't think my nurse likes me.
Who cares?
And I say why?
Who cares?
But Sam,
okay.
It does matter to them because everything is based on how we feel in this generation. And if they perceive that you don't like them, then they're scared to ask you a question. So prefacing, hey, we are busy right now. I'm so glad you're here. I'm not going to have time to let you do as much, but please stay right on just like you said, Kelly, just stay right on my heel. Don't be on your phone. Be right with me. Wherever I go, you just follow me like a leech unless I tell you, hey, I'm going to the bathroom. You don't follow me there. Right. Like, makes a big difference for them to at least know that, hey, regardless of whatever exterior factors are going on, me and Kelly are good. Mm-hmm. Even if she's short with me, whether like, hey, I might be short here or there, if I'm telling you where to be, I need you here. Like, do not take it personal. It's time, efficiency to like explain why we're going to be that way goes a long way for the student to still like feel wanted and welcome instead of like, well, does Kelly like me? She told me to just go there. She didn't use my name. She didn't use it. I'm like, okay, she was probably busy. She probably had a situation with family or a doctor, we need this lab or we need this thing done now. And she's got 3 more kids that need stuff done. Like, because again, they don't have that self-awareness of like outside their perspective to realize that Kelly's feeling it right now as just a nurse on top of trying to make sure that you see or experience something. And she doesn't have time in her emotional, mental capacity for the 4 or 5 or 6 patients she's dealing with in the ED to also worry about your feelings. However, that initial interaction when they introduce them, say, hey, if we get busy, do not take anything I say personal or anything. It's just we got to get through whatever's going on and then we can recoup afterwards. Okay.
Mm-hmm. That's fair.
Because they're very, like I said, they're very like eggshellish with their emotions and stuff.
Yeah, I guess.
Why do we have to give them the crap sandwich when we give them feedback, right?
Oh,
This is what you did good. Here's what you need to work on. Keep up with what you're doing good.
And being liked is totally a currency. Like I try to teach my boys that too. I'm like, it's actually beneficial to learn to be liked. Like it will just make every situation that you go through better. But there's also like, I love a good grumpy doctor. Like you don't like me? Fantastic. I have 8 more questions for you. I also am going to call you in a little while because you're grumpy.
That one's accepted. Yeah. Let's see how many times I can.
Yeah, that's exactly right.
I can't function without him. So he better get used to working with me.
That's right. Oh, but no, point taken. I think, I do know that there's a lot personally that I could do. And I think in some more established nurses that, maybe 10% of the problem is us. Maybe.
That's fair. Yeah, right. Yeah, we don't all have the best day or the best interaction or the best response, or we got stuff going on in our personal life. Like I try and preach perspective.
Yeah.
Like I don't know what's going on in Sam's life this shift. I don't know what's going on in Kelly. They don't know what's going on in mine. Yeah. But like we got to figure out a way to coexist, and we got to figure out a way to communicate clearly and effectively. And if that means occasionally we have to have a phone call about why the hell the doctor's putting orders in, then we're going to have that, and it's going to be a little tense. And then later on, I'm going to say, "Hey, you cool? I'm cool. Appreciate it. We got."
Was that conversation tense? I don't even remember it being tense. Well, was I tense with you? I'm so
You're
sorry.
always tense.
No, I was feeling your frustration through the phone.
Oh yeah, well that's fair.
Again, I try to be aware of that. Like, okay, this is pissing Sam off, so I need to be a solution and not like name blame or excuse or anything. Like, okay, cool, I'll figure it out. I'll deal with it.
100%. It was an ER.
You had like 20. You had like 20 or 25 patients still too. So like, we're trying to get like, I get it. I know other floors like, oh, we can't take it right now. Then like, if I can't take it, it's like I literally am cleaning the bed myself, putting the bed in there. Give me like 5 minutes, I'll rock and roll.
Wait, hold on. You can do that? You can clean a room yourself, Jameson?
Oh, sorry, I let the cat out of the bag there.
We don't have to wait an hour and a half for EVS for a clean room? Ugh.
I would love to like just say that the incoming nurses just need to get with the program and fit with the mold, but sadly, like that's just not how,
There's definitely an aspect to that, Sam.
Yeah, we're on the way out, Sam, and they're on the way in. So,
well, I know, but I feel like there are like edits that I could make too. Like ideally, they would all just be me, and it would be so easy and fantastic. But they're not, and so I probably could work on me a little bit and like learn, knowing what they go through, especially walking through that sim lab and being like, oh, this is what you guys are telling them nursing is like.
Yeah,
that's why you don't get it. So that was helpful.
Yes.
That was helpful. Yeah.
Well, I think we are about ready to move into our pulse check. What do you think, Jameson? Are you going to hang out with us for a minute?
If you'll have me, I'll hang out.
All right. Here we go. Pulse check. All right. Who has the first question?
I have a question.
Okay, I'm ready.
Would you rather meet your great-grandparents or your great-grandchildren?
Oh, grandchildren. 100%.
Oh, really?
Great-grandchildren. That would mean that I'm going to be really old and then I wouldn't have to stress out about death.
Well, I don't think that you're alive for this question. This is like if you could have dinner with anyone alive or dead, who would you have it with?
Oh, well, no, probably my great-grandparents then, because my great-grandchildren are just going to be horrible.
That's sort of how I felt. I was like, if you guys suck, I don't want to know. I'd rather meet my great-grandparents.
Yeah, like it's not in my...
Yeah, but my great-grandparents, I mean, my grandma was born in 1918. She passed away, but she had her children really late in life.
Yeah.
So, I mean, they would have been alive in the 1800s. So that'd be fascinating.
Yeah, I think it'd be cool.
I think grandparents as well, just to hear the history, right?
Yeah.
And what they went through, what daily life was like.
Yeah, and tell them that it worked out okay because their great-grandchildren don't totally suck.
Yeah, look at me. I'm amazing.
Ollie's fiddle teacher's dad was born in 1924. And she's 40. I know.
Okay.
I was like, it took me almost his whole lesson to do the math on that. But anyway, okay, grandparents. Well, that was a resounding. That's great. We agree. Moving on.
This one is kind of based on, I think I know Jameson's answer because we're doing this episode. Would you rather start from day one and go back through nursing school? Like now, like you just have to like redo nursing school, or go back to school for absolutely anything else in the world?
Yeah, number 2, probably.
Yeah.
Option 2.
Yeah.
You couldn't make me sit through nursing school again, knowing what I know now. There's no way.
Yeah. I would be a terrible student.
Yeah.
I know.
Absolutely.
I'd be like, I am smarter than my instructors.
Yeah. Like,
waste of time.
They talk about stuff. I'm like,
nuh-uh.
I'd be making Sam's faces all like I'd have no filter. Just be like,
what would you go back to school for, Sam?
Oh, maybe something in law, except they say that IT is going to take over like all the lawyers. So I don't know about that. Or I don't know. I don't know. Something fun, maybe business or.
Yeah, I think I'm on the business train just because I have all these great ideas of businesses that I would want to start, but I have no idea how to run a business.
They always look so pretty in their like just beautifully tailored outfits. That's just what I want it for. And the awesome high heels. That's it.
Okay.
This one look like suits.
Yeah. Ooh.
Jameson's already going back to school, so.
Do you have a question, Jameson?
Right, yeah.
Keep going.
Do you have a question for us, Jameson?
What is your guys' go-to thing to decompress after a stressful shift?
Oh, right after?
Yeah.
Oh, I have to tell someone about it.
Like even if it's like first thing in the morning, Sam?
Yeah.
Like you come home and tell Philip?
Yeah. Mm-hmm. Yeah.
I don't do that at all. I like to keep it inside, bury it deep down, have a glass of wine, and either watch trash TV or Instagram reels. I have to just shut down mentally.
What do you do, Jameson?
If it's really bad, I'll come home because my wife's usually up because she works a day shift life. And I'll just be, hey, it was a rough night, and we'll just sit for a second, just hold hands, and I'll just say how. I try not to bring any details, obviously, with HIPAA and all that stuff, but just hey, it was rough, and she knows that's our code word. Someone either died or near died or something really bad happened, and so, and then I'll usually my dog does not get to sleep on the bed very often at all, but that's one of those days when if I'm coming back to work the next night, I might need some dog cuddles in bed. Yeah, especially if my wife has to work.
Nice and healthy.
Well, it didn't used to be that way. It used to be a shot of something and some trashy food, and that's always great.
There is nothing wrong with that. There is nothing wrong with a shot of trashy food.
And I love that you're I don't give details and I protect HIPAA. Mine is always HR things that I have to protect. And this person freaking did this, Philip, and she thinks that she knows everything about everything. And don't they know they're going to freaking kill somebody?
Yeah.
That's usually more what it's like.
Yeah.
Okay. I have a question about nursing school. Give me 1 to 3 things, maybe an adage or a specific piece of information that you still remember from one of your classes in nursing school. Do you remember anything, Kelly?
I remember one class. It's probably very basic, where I could not understand the difference between systole and systolic. And
okay.
Because they kept throwing out these words, and I'm like, what are they talking about? Anyways, I remember that moment sitting there and writing down, I have to look this up because I know that they're similar, but I don't really know what they mean. So.
In a dictionary, because there weren't computers.
Yeah. Oh, yeah. Do you remember your medical dictionary? That was the best. Oh, I loved my medical dictionary.
Yep.
And then I'm going to stick with just that for now. I'll keep thinking. Okay. You got one, Jameson?
One of my favorite clinical instructor told me is something I've carried with me. I can't coin it. I don't know where but he was the one that first introduced the idea of being present. He said because I had some emotional, personal stuff going on one semester when I was with him at clinical, and I kept bringing it with me. And he's like, Jameson, you've got to figure out a way to be present when you are here and leave those problems behind you. I need you to be present and engaged right here. You can deal with that stuff when you get off shift. You can deal with that stuff this week, but when you're here, your patients need you. And it's just something I've held on to because he was truly one of my inspirations for pursuing this and how he connected with us, but also how he brought some wisdom to what was going on. And I don't know, that's just always stuck with me wherever I'm at. All my different hats I wear, every different job or this I got going, wherever I'm at, I'm present. If I'm here with you guys, you're getting full Jameson attention. If I'm with patients, they're getting my full attention. If I'm at home with my wife, she gets my full attention. I really strive to be present wherever I'm at. That really stuck with me. I think not just in nursing school, but in my life.
Yeah, that's an amazing lesson.
That's good advice. And I think some of us learn the hard way when we're at work and maybe when we get comfortable and we stop being present. And then, the worst happens. Yeah. I remember being told, leave a fed or leave them dead. But that was when leave a fed was a third line. And now it's first line. So it's not quite the same, but I will just never forget that she said that. I just will remember my OB teacher making this movement. Don't take it out until the surgeon tells you to. Got it. I absolutely will not. If I see a cord, that's what I'm going to do. I'm not going to take my hand out until the surgeon tells me. And then my mom taught me a number of things, but that don't sit down has stuck with me, and it is what I expect of other people too. You don't take a nurse's chair unless you're specifically given permission to do so. And I don't know. It served me well so far, I think.
I remember one more thing. During my clinicals, I did my practicum was in adult ICU, and I was on night shift, and there was this like homeless man that was in a coma on a vent, and my preceptor, she was like, well, if you need to practice IVs, why don't you just go poke him?
What?
And me as the nursing student was like so disgusted. I was like, I don't feel like that's ethically correct. And like it was like the first time like I like said no. I was like, I don't think I'm going to do that. I don't think that's right. And then having like the charge nurse come, and she was like, good job. You shouldn't do that. That isn't right. Aww. And that like stuck with me as like, oh, I can like stand up for like what I know is the right thing to do, even against like these upper nurses. And I think that like taught me like a very powerful lesson of listening to my gut and listening to my instinct, and having that charge nurse come back to me and say, good job. Like, yes, that was not okay. Like if you would have gone in there and started poking that poor man, you would have been in trouble.
That's like a crazy thing to offer to someone. I mean,
right? I know.
If the orbits of like the moon and the sun around the earth weren't like technically a thing, would you rather have, I know, Kelly, I'm going somewhere with this. I had to get that out of the way or else it won't make any sense. Would you rather have more hours in the day, another day of the week, or another month in the year?
Oh, I feel like there's a lot of variables there.
Well, that's why you can't think about like the sun and the earth and the moon, because, you know, you can't have any more.
I'd like more hours in a day.
More hours in one day. Okay.
I think I'd go one more day a week.
Okay. I think
I feel like then you'd get like an extra day to do stuff.
I think a whole month in the year wouldn't feel like a big difference because you just keep rolling. But I don't know if I would fill the hour, probably. But would I also just fill another day? Probably. I don't know. I feel like maybe an hour a day.
Is if it was like a surprise, like daylight savings, right? Where like they just like, you know, crazy ass Trump comes on and decides that, you know, we're just going to have one more day this week, and everybody just do with what you want,
like your school schedule.
Yeah.
You just randomly
arbitrary breaks. Hey.
Yeah. It's like, hey, guess what? We have this new day called Frong or something. I don't know. That
perfect.
Frong Day. It's Frong Day, and it is just given to us randomly.
You're welcome. And tomorrow will still be Monday. This is like literally we're not changing anything. It's just a magic day right now. Yeah.
Oh my gosh. It would probably, the whole world would probably collapse. Nobody would know
behind that. Why? All of our calendars are controlled by Apple. So if I wake up and they tell me it's the same day over again, who am I to judge?
Right? Oh, like daylight savings. Instead of going back an hour, you go back a whole day.
A whole day.
Ooh, it could be a real life Groundhog's Day.
Now that
I don't want to do it over again, though. I just want to have nothing to do.
No, but what if we made Groundhog's Day a real thing? Like at the end, at midnight, it just Groundhog's Day starts over.
On the 2nd?
Yeah.
On February 2nd?
Yeah, you just have 2 February 1st.
Okay, well, you know, find your local legislature and write them a letter.
I feel like there are harder things to figure out in this government than giving us a second Groundhog's Day.
So then why not have an easy win? Leave the hard things for the smart people.
Yeah, morale booster. Morale booster.
Morale booster. Here's a free day.
Free day.
Woo-hoo!
Just don't act like the purge.
Oh. Where would you go? Okay, I do have a real question. What would you do? Where would you go?
I don't know. I think we need to take the week and think about this. And we're going to start off next episode with what we're going to do with our free day.
No. Where you would go.
The purge was going on?
Yes.
Oh, we're talking about the purge?
Yeah, I was like, everyone knows somebody that has like their own, you know, one of those slightly crazy people who have their own bunker and like a crap load of guns and stuff. Like everyone needs to know someone that has that.
Yeah. I might go to the hospital. Isn't that like a locked down? I might work that shift. But then what about your fingers?
That'd be fun to work the purge, actually.
Yeah.
You could send students in during the purge and they would learn so much about trauma.
And we so many curse words.
So we found the one day that Sam will take my students.
Yeah, that's right. That's true. I'm like, put your finger here and don't take it off.
Jameson, is the purge happening? Then no. I'll walk in my black coat. It's like, it's not this day, Jameson.
Not today.
Not today.
Well, Jameson, thank you so much. I actually I think it was a very fun conversation, and I appreciate you giving us a little insight into what's going on with who's coming up. I know it's very helpful for me. I don't know if it will be helpful for our listeners, but yeah.
Maybe someone out there will realize, like you said, maybe we're 10% of the problem, and there's something we can do to try to help bridge that 90% gap.
Donuts make me happy too.
Oh, that's fair. That's fair. It's always a good strategy.
I'm not in this context above bribery.
Everyone has a candy drawer. Everyone has a candy drawer.
Yep.
Well, all right, guys. This wraps up another episode of At the Nurse's Station. Thanks for hanging with us. We drop every Tuesday. Kelly's doing a really good job of making us look good on socials and previewing a lot of our episodes. So follow us on Instagram and Facebook. And until next time, we'll save you a seat.
Bye.
Hey guys, this is Kelly from At the Nurse's Station. Sam and I would like to remind you that the views and opinions expressed on this podcast are strictly our own and do not in any way reflect the position of our employers. This podcast is for entertainment purposes only and in no way should be considered medical advice. As always, consult a qualified medical provider for questions regarding your health or medical conditions. We hope you had fun listening to us today, and we'll see you next time at the Nurse's Station.